السلام عليكم ورحمة الله وبركاته. Welcome to Hip Anatomy. We continue to discover this area. This is very important area in our body, the hip region. We started by the bones. We talk about the innominate bones and the hip upper femur, which forms the hip joint. And then we describe how the articular surface formed the acetabulum and the head of the femur. And then we going to take the second layer or cover the acetabulum by leonate cartilage and the vulvar in the acetabulum fossa and to complete the acetabulum cavity to fill the acetabulum notch by a transverse acetabular ligament. And beneath of it, we know that there is acetabular foramen that enters the blood supply and nerve supply to the acetabulum. Then we're going to the acetabular head, the head of the femur, and how it is covered by the articular cartilage. Then we encase the hip joint and stabilize two bones together or connect two bones together by the capsule, which is lined from inside by the synovial membrane, and from outside, it is reinforced by the ligaments, very strong ligaments, and then padded by bursts. Today we will continue our talking about the hip region, and now we will discover a new era in the hip region, the blood vessels and the lymphatic drainage system. First we start to describe the blood vessels here. Blood vessels, I mean the arterial blood vessels and venous blood vessels. For your knowledge, the arterial blood vessels and venous blood vessels have the same pathway, have same uh, the same name, the arteries and veins. Let's talk first about the veins. Here is the descending aorta, abdominal aorta, and it bifurcates to right iliac artery and left iliac artery here, and then it bifurcates to external iliac artery and internal iliac artery. The external iliac artery pass all the way downward to nourish and feed the lower limb with enough blood supply through the femoral artery. The femoral artery is just we change the name. As external iliac artery passes underneath the inguinal ligament, it changes its name to be a femoral artery. Also, we have here, this is external iliac artery, this is the internal iliac artery. Internal iliac artery, it has two divisions, the anterior division and the posterior branch. The anterior branch has the obturator artery and inferior gluteal artery, and the posterior branch has the superior gluteal artery. And here, from the femoral artery, we have a deep femoral artery. We have this is lateral circumflex artery, and this is medial circumflex femoral artery. Now we want to talk about the hip region. The hip region has a network of capillaries, blood supply capillaries, arteries, and and capillaries and veins and venules. All of this area here. This network is supplied or nourished by five big arteries. The biggest one, or the master, is the medial femoral circumflex artery that is bifurcates from deep femoral artery. It comes from femoral artery, from femoral artery, deep femoral artery, lateral femoral circumflex artery, and medial femoral circumflex artery. The medial femoral circumflex artery is the main blood supply to the hip region, and this is the lateral. This is the second artery, and this is the obturator artery. Obturator artery that nourish. You remember that when we said that we have acetabular foramen, and from the acetabular foramen, the blood supply go through from the obturator foramen here to the acetabular foramen to enter the capsule through the ligamentum teres to the head of the femur. This artery has its blood supply from the obturator artery. Also, we have from here, from the anterior branch of anterior branch or anterior branch of the internal iliac artery, we have inferior gluteal artery, and also from the posterior branch, we have superior gluteal artery. These five arteries make an anastomosis for and nourish this network of blood supply. Let's talk in deep now. This is okay. Before we talk about the hip, I want to talk about the veins. I said that the veins had the same course, had the same pathway, has the same names. Everything the artery has the same as the vein. So here, but we have one exception. This is as a descending inferior abdominal aorta, and this is as inferior vena cava. But here we can see this is iliac artery and this iliac vein. Iliac artery, iliac vein. This is external iliac artery, external iliac vein. Internal iliac artery, internal iliac vein. The same name, all the same. Okay. Now I want to be specify about or talk about clearly about the blood supply of the hip region and head of the femur. This is very important because head of the femur undergoes a development in the early age, and also this blood supply can cause avascular necrosis and damage of the hip joint. And it is the hip joint is the master joint. It is the master joint that transmits the body weight. So any interruption in this joint can interrupt all our health wellness. So we have to know well what the blood supply to understand the trauma if it happened, like dislocation or fracture, or even we have some diseases like Behçet's diseases and something, or even a dislocation or something like that that could happen to the hip joint. This is the network. You see, this is the network. And this network, I said before that we have five arteries that nourish this network by anastomosis. This is the deep femoral artery. Deep femoral artery, it is a branch from femoral artery. And this is the medial circumflux femoral artery and lateral circumflux femoral artery. This is from the anterior hip here, and this is from the posterior, and this is the ascending arteries or along the neck of the femur and the capsule. And this is, we have to know that what is that? This is the epiphyseal plate. This epiphyseal plate is very important. First, at the early age, all the arteries are passing all the way up to the head of the femur, and also here, this is the ligamentum teres, which has the femoral artery. Femoral artery has a blood supply from the obturator, what I said before, from the obturator artery, and also from the medial circumflux femoral artery. So we have a blood supply from up and from supply from down here to the head of the femur. That is the normal way. At the early age, we don't have a problem. All of these arteries nourish that area. From 4 years, at 4 years old, this end plate enlarges and become thick and prevents most of this blood supply to pass to the head of the femur. So this anastomosis, this blood supply could be anastomosis by medial femoral circumflux artery, which is the main one at that time, in addition to the weak acetabular artery or femoral artery that has a blood supply from the acetabular artery from the ligamentum teres here. After the age of 8, this end plate calcified. And at that point, the arteries can pass again to the head of the femur, and the medial circumflex artery again plays the main role in nourishing that area. Don't forget this, the blood supply in the most superior and posterior part here is the main blood supply for the head of the femur from the medial circumflex artery, this one. So fracture at this area or dislocation could interrupt the blood supply, and that means causing avascular necrosis or even interfere with the development of head at that, especially at the early age. Also, I want to talk about the blood supply of the labrum. I said that the labrum is extension of the acetabular acetabulum rim and attach it to the acetabulum rim. I want to divide the labrum. Labrum is like a wedge structure with a wide base and narrow lips. This wide base attached to the labrum. The labrum is to the rim of acetabulum. Acetabulum rim has a calcified part and a non-calcified cartilaginous part. The leonate cartilage is not calcified. However, the acetabulum labrum is calcified, and this is the trademark between them. Okay, so I want now to divide into four parts. First part is the capsular and outer part. I divide in and out. The blood supply run from the articular rim here all the way from the outer side to nourish it very well. And this one can undergo regeneration in a very mature way. However, the inner part, this is the articular part. He is supposed to be he is the head of the femur. The upper part or the outer part here of the labrum in the articular area also has a good blood supply. But this one has a little blood supply and bad blood supply. This is the articular and inner side because it has its blood supply or its nourishment from the leonate cartilage. And this is a very poor one it takes its blood supply or its nourishing from the leonate cartilage, from the synovial membrane, and from the synovial fluid, and also from this the outer part of the labrum. Now, finally, we will talk about the lymphatic system. It's important to know the lymphatic systems that pass in this area. Okay, this is the inguinal ligament. This is very important ligament here from the tubercle of symphysis pubis to the anterior superior iliac spine. We have here a lymph vessels and lymph nodes. Lymph vessels carry the lymph. The lymph, it is extra fluid from our body and the viruses and bacteria and the high molecular proteins. These lymphs carry this lymph all the way up till the superior vena cava and then to the subclavian artery and to the heart again and going to the systemic circulation once more. This lymph collecting all of these fluid, we have these vessels. This is a femoral vessels, we have inguinal vessels, and we have lumbar vessels. This femoral, inguinal, and then lumbar vessels. And then we have lymph nodes. These lymph nodes, it's responsibility to attack the germs, the bacteria and the virus inside this fluid and kill them, and to make the blood supply clean again, so the lymph clean again to enter the blood supply without any problem. Because if it has some germs or something like that, it could be disseminated in the systemic circulation and to causing sepsemia. See here, we have these lymph nodes. We have lymph nodes, we have an inguinal lymph node. We have three types of lymph node. We have a superficial and deep. In superficial, we have a horizontal and vertical. So we have a horizontal lymph nodes and vertical lymph nodes, which is superficial, and also we have a deep lymph node. All of these lymph nodes are present in the inguinal area. If we have any kind of inflammation, you will feel pain at this area or groin or subinguinal area. Thank you for your listening. Now we finish the blood vessels, the arteries, the veins, the lymphatic systems, and next time we will talk about the nerve system, how the nervous system and it's passing here in this area, what the nerve is, especially the sciatic and femoral nerve. Thank you for listening.